everybody, my name is Anna Garcia. Today I'll be demonstrating how to use a glucometer. Have you ever met someone who is a diabetic? Did you ever stop to think, how is it that they monitor their blood glucose? Or in easier terms, how is it that they measure or monitor their blood sugars? Patients who are diabetic have a small handheld device called a glucometer. Whether it's yourself or someone you love, it is very important to know how to properly use a glucometer. In today's lesson, I will explain what a glucometer is, how to use one, and why is it important for diabetic patients to monitor their blood sugars. The purpose of a glucometer is to measure the blood glucose in the body. For a diabetic patient, this is very detrimental. It can tell them what they need to do that day, whether it is to hold off on their medication, take their medication, or limit certain foods in their diet that day. For patients who have diabetes, they typically have a device called a glucometer. It comes in a little pouch like this, and it looks like this. It is very small. It fits in the palm of your hand. It comes with a little shooter that you put your little lancet in there to prick your finger, and it comes with the strips. What the patient will do primarily is wash their hands if they have access to water and soap. If they don't, they can use hand sanitizer or they can use a little alcohol pad. What they would do is grab their machine, insert the strip, it'll turn on the device. With clean hands, they would grab their little pricker. They can use their index finger or their middle finger, and you would use the top of your finger. So you would squeeze, punch, wipe away with the alcohol wipe or a napkin, squeeze. When you see the drop of blood, you would grab your device, put it to the device, and within a few seconds, it should give you a reading with your results. Once the patient has the results, they are able to log it, whether it is in a traditional little notebook, or if they do have a more modern design or device, the device sometimes are linked to smartphones, whether it's an iPhone or an Android, and they can monitor and keep a log of their results like that. The importance of monitoring their blood glucose is to avoid having too low of blood sugars or too high. It'll also keep a good patient and healthcare provider relationship, because the doctor can adjust the patient's medications, whether their levels are constantly low and they're not feeling good, they can adjust that, or if they're too high, they can add additional medication to their regimen. A glucometer is easy to use, and it helps monitor blood sugars. It keeps our patients safe and healthy. Interesting facts about diabetes are that 38 million people have diabetes or are diagnosed with diabetes. 1 in 5 patients can go misdiagnosed or undiagnosed. Also, diabetes is the 8th leading cause of death, but knowing how to monitor a patient's blood glucose can save their life. For additional information, you can check on www.cdc.gov/diabetes. Thank you.